Hello and welcome to today's webinar on public health careers outside of the public health sector, which is part of CPHA's webinar series on a career in public health shaping your future. My name is Emma Malik and I am CPHA's Manager of Communications. Now, if you've participated in another webinar in this series, you'll have heard this spiel before, but for those of you participating for the first time, and as a bit of a reminder to everyone else, the Canadian Public Health Association is the largest, oldest, and most established independent public health organization in Canada. We have over 1,200 members, approximately half of which are students and trainees. Students, we hear you. We know that you have distinct needs. You may be interested in a career in public health. You may seek mentorship and networking opportunities with other public health professionals. You may be seeking additional sources of funding through student awards and bursaries. CPHA recognizes the needs of students and has tailored programs and services just for you. This webinar series is one such example. Since September 2006, we've been holding monthly webinars on a variety of topics that are directly relevant to students, on topics such as leadership, finding a job, and today's webinar on careers outside of the public health sector. So I'd like to find out a little bit about who's participating. Where are you based? If you could respond to the poll. So about half of you are based in Ontario with a strong contingent from Alberta, BC, and Quebec, as well as representation from some of the other provinces. Great. Now, I'd like to know a little bit more about whether or not you are a student and what level of student. So we have a lot of MPH students and graduate students, a couple of undergrads, some other. For those of you who selected the other category, feel free to type your response to introduce yourself and let us know your background in the chat box option. Great. Now, are you a member of CPHA or of the Public Health Physicians of Canada? We are a member-based organization and we have a category of membership for students. So great to see almost 2/3 of those participating are members. And those of you who are not members, great to have your involvement as well. And if you have questions about membership, we can come to that later on in the webinar. So thanks for taking the time to respond to those polls. I'll return to the presentation now and explain a little bit about how the webinar will work today. All of the participants are muted, but you can update your status throughout the webinar as needed using the options displayed on the screen. For example, speak louder or softer. We ask that you please post your questions and comments in the chat box visible to all participants. And in a moment, you will see a comment displayed in the text box so you can see how that appears. If we can't answer your question during the webinar, we will follow up by email. And this webinar is being recorded. The recording will be made accessible to everyone that's registered for the webinar shortly following today's webinar. And we make the slides and recording more broadly available on our website 3 months after the webinar. At the end of today's webinar, you will be redirected to a short survey. Please take a moment to send us your feedback. It's my pleasure to introduce today's speakers. Annie Duchesne has undergraduate degrees in science and journalism with a minor in music from Concordia University. She completed a master's in public health at McGill University in 2014. She currently works as the research coordinator for one of the largest homeless shelters in Canada and volunteers her time as a board member for the Canadian Public Health Association. Dr. Qosa is managing health recovery projects for the Canadian Red Cross in countries affected by different kinds of disasters or crises, such as in Syria and Palestine. Dr. Qosa has more than 4 years of experience in clinical practice in intensive care units, emergency room, and anesthesia departments. He has a medical degree from Yemen, Masters of Medical Education from the UK, and a Master of Public Health from Western University in Canada. So with that, I will turn things over to our first presenter, Annie.
Hi everyone, welcome to the webinar today. I'm so glad to see that so many people could make it. As Emma just said, my name is Annie Duchesne. I'm a member of the CPHA Board of Directors. And since graduating from my Master's of Public Health, I've been working as the research coordinator for a joint project between McGill and the Brewery mission, which is one of the largest homeless shelters in Canada. This project examines an extensive administrative database spanning over 10 years to look for population trends, learn more about the needs of the homeless population, and develop policies and programs. We hope to build the knowledge base on homelessness and to share our findings with others all across Canada. I never imagined that I would end up researching homelessness as a career. I honestly thought that I would go on to be a policy analyst or something of that nature, but this job is more interesting and challenging than I ever could have imagined. First of all, I have a lot of freedom to explore the topics that interest me. I've spearheaded several projects, including a needs assessment of the population, an innovative way to conceptualize different groups of people who use the shelter services, and a project that examines the effect of certain shelter policies on returns to homelessness. Our research has been published in book chapters, presented at conferences, and published in academic journals. My work and the work of my colleagues has helped to transform shelter services at our organization from a traditional emergency-based model of service like this, so bare bones, massive dormitories, and minimal supports, to a more cohesive and supportive system that includes tailored services, more casework, and long-term programs to help people get out of homelessness. My job draws heavily on my public health background, but most would consider it to be outside the public health realm. And it's actually not uncommon for graduates of public health programs to work in other fields because we gain so many great skills from our programs. I actually did poll my graduating class to find out what they're up to now, which was fairly easy since we were only 9 people in total. And here are the results. So where are they now? One person is doing their second year of medical school. Another person is a project manager with McGill University's Health Center, Division of Clinical Epidemiology. We have a project manager at Stanford for healthcare implementation. There's a data analyst, cancer analytics at the Canadian Partnership Against Cancer. One person recently completed her nursing program at McMaster. We have an epidemiologist at McGill University Health Center. There's a program analyst at the Provincial Council for Maternal and Child Health. And then another person has done their doctorate in epidemiology. This is just a visual breakdown. A few have gone on to pursue additional training in other fields like nursing, medicine, epidemiology, and all the rest of us are working in research. Most of the research is health related and in a particular field like oncology, maternal health, etc. I think out of everyone, I strayed the furthest from a most traditional public health job. So if you are interested in expanding your options and looking for work outside of the traditional realm of public health, I hope I have some advice to help you guide your search and application process. So the first thing to consider when looking for a career outside public health is to look for your passions. So while I was in school, I discovered that I was really passionate about the social determinants of health. The dozens of social gradients, including income, race, housing, employment, working conditions, etc., that determine up to 70% of a person's health over their lifetime. Finding your passion helps you to open up your job search options and keeps you interested in whatever job you get. I consider my work's connection to social justice and the social determinants of health to be the most important thing that keeps me driven and inspired. Second, I urge you to find your strengths. Think about what you're good at. Are you a particularly good writer? Well, then maybe policy or knowledge exchange is for you, even if it's not health policy. Are you able to make connections easily? Maybe research is your strength. Are you able to be convincing in a debate? Well, maybe you're a natural advocate in that case. What your public health skills are depend largely on your program. Each public health program is slightly different. Each has a different focus. Some are more research heavy, some are more policy heavy, and then of course there's the practice programs in medicine and nursing, etc. So if your program is research heavy, you will probably be good at conducting all kinds of research, which opens doors in multiple sectors, including pharmaceuticals, hospital-based clinical research, government, insurance, private consulting firms, etc. You'll have a good understanding of how studies are designed and analyzed, and of research ethics, and this will take you far in terms of your ability to meet the criteria for many different kinds of jobs. If your program is policy heavy, you will be good at finding, weighing, and analyzing evidence from multiple sources. You'll be good at communicating findings to lots of audiences and examining an issue from many different perspectives. And then you'll be able to make appropriate recommendations based on evidence. So doors will open in government and NGOs and advocacy organizations, etc. If your program is practice heavy, you will have the professional skills you need to practice in a hospital, a community clinic, a home health agency, or a long-term care facility, but also consider alternative careers in education, research, politics, other kind of outside-the-box careers. I would like to talk briefly about searching for a job. I have a few pieces of advice that hopefully will help you when you're looking for work after graduation. The first is work your connections. I learned about my job after approaching a guest speaker in one of my classes. The truth is many jobs go unadvertised, and job searches can be long and frustrating. So the more networking you do, the better your chances will be. While you're still in school, apply to go to conferences. Go to additional lectures given by people with careers you admire. Approach people and ask questions, and exchange contact information. This can be hard at first. I recommend starting with people you know or friends of friends to get some practice in. But in my experience, people are generally thrilled to help and to answer your questions. For more on networking, I found a nice concise article from CIO that has tips on business networking for shy people. I think they're good tips for everyone regardless of their level of social ease or their profession. So I've added that article right there. Networking isn't just about exchanging names and business cards, though. That's the kind of superficial networking that people think of. It's more about making personal connections with people and finding things in common. So, like all relationships, they require work and follow-up. Stay in contact with your connections by making phone calls and sending out emails. If you're looking to expand your network of public health professionals and other CPHA members, I highly recommend that you check out the CPHA membership directory. If you're a member, you can log into your CPHA profile. It's the same way that you get to all the saved webinars. And then you can find the list of fellow CPHA members there. You can search by organization, you can search by sector, you can search by name if you are looking for a particular person, and if they've agreed to have their name published, it will show up in the directory. And this is already a bit of an icebreaker to start with CPHA people because you already have membership in common. So that's something to consider as well. Other kind of miscellaneous advice, check constantly for postings and in many different locations. A lot of graduate offices have bulletin boards with postings all over them. Check the government websites often, check lots of different kind of employment aggregate sites. You know, some things are only advertised for a short period of time, so just keep an eye out. And the other piece of advice is don't be too picky. And I don't say this to discourage you or to say like, oh, there's no jobs out there. That's not the case. It's to say, it's to more encourage you to open up your searches to other different kinds of things. You never know what will be interesting to you, and you might be qualified for lots of different things. So keep an open mind as far as the job search goes, and you might be surprised at what comes up and what might be interesting to you. If you're interested in learning a little bit more or hearing other people's experiences, check out the American Public Health Association Careers in Public Health newsletter to hear more about people's job hunting experiences, and the link is also there. I would also like to say keep your CV up to date. Include details of your work and your accomplishments, but don't write a novel. That's kind of my advice on resume writing in a nutshell. I had the opportunity last year to screen candidates, conduct interviews, and hire a new person for my research team. And this has fundamentally changed the way that I see job applications. I used to think that writing huge amounts of text and describing every position and every reason I was applying for this job, and now I would recommend against this. For a recruiter, sifting through dozens or hundreds of applications can be very overwhelming. If a person doesn't obviously meet the criteria for a position, then they're quickly screened out. So the best thing to do is to briefly write out how you meet each of the criteria right in the cover letter. This makes it easy to be screened into the process. As well, in your resume, include only relevant experience and limit your description to a few points. One tip that I got from a retired high school principal who did tons of hiring over the course of her career was to include one experience or skill that's interesting or unique. This helps make your CV more memorable without weighing it down. I got more callbacks when I listed public speaking and performance under skills and talked about performing in semi-professional choral ensembles than I did with any other resume. Your unique and interesting fact or experiences could be related to the kinds of hobbies that you have outside school, or it could be an interesting project or award related to your schoolwork. This is just something to keep in mind. Overall, I would recommend keeping the whole thing short. Cover letter should be no more than a page, a CV shouldn't be more than 2, and have your references lined up. Choose people who are familiar with you as a person and people who are familiar with you as a professional. Tailor each resume and cover letter to the position that you're applying for. If it's a policy analyst job, talk about the classes you took in policy, your policy that you did in your practicum placement, any volunteering that you've done in policy departments of a local NGO or anything else. And take the time to learn about the organization that you're applying to. What have they developed, published, accomplished lately, and how can you contribute to their continued success? Lastly, I would just like to talk about staying involved. So one of the best things to do, especially if you get a job outside the public health sector, but still have your heart set on a public health career, is to stay involved through volunteering. There are plenty of local and national organizations that rely on volunteers to govern, develop policy, advocate, organize networking events and conferences, and more. I personally have stayed involved in the public health sector through the CPHA as a member of the board of directors, and there's a student director position that's open to all CPHA student members. And it's an excellent way to gain experience, make valuable connections, learn about NGO governance, and stay up to date with current public health issues. So consider getting involved in the CPHA or in other organizations near you. This benefits the community, but it also sharpens skills that will be valuable to you in the future. So at this point, I guess I'll pass it on to Haytham.
Thanks, Annie. Before we get started with Haytham's presentation, there are a couple of questions that perhaps you'd like to address now, since they directly relate to your presentation. So Lisa is asking about your comment on not being picky. However, if there are specific criteria listed in the job post, and you are not able to demonstrate each of them, would you recommend applying or not applying to that job?
So often the criteria are listed as like absolutely necessary, and then assets, right? So if there's criteria that are not absolutely necessary, I say go ahead and apply for that job. If you don't meet every single one of their wish list, then you can demonstrate other ways that you can be useful to the organization. However, if it is one of those things that they absolutely require, it probably isn't worth your time, just due to the screening process. I see a couple of more questions here. I don't know if that completely answered your question, Lisa, but I can really only talk to my experiences with hiring. Hannah also has a question, I believe, that a resume should be short and to the point, but a CV can be long and much more detailed. I mean, it is really a judgment call. I'm pretty sure that nobody wants to read a 5-page CV. You can include just sections of what experience is relevant to this particular job, and then have just bullet points what you've done in between if it's not relevant, which is how I've managed to cut down my personal CV quite a bit. But if you can't fit it on 2 pages, it's not blasphemy to keep it a little bit longer. It's just a matter of what your recruiter is going to be screening for and how much time they're going to spend on it. And I can tell you it's going to be like 2 to 5 minutes. So if they can't get through your CV in 2 to 5 minutes, and all that information isn't readily available, then it's going to be very difficult for them to screen you into that process. The next director, when will the next director be selected? I believe the next director position, it's a 2-year term, and we have a student director that was elected in 2015. So the next student director position should be opening up in this year, in 2017. So if you're interested, have a look and see what it entails, and try and find an application. I know that they're available online, or you can request one directly from the CPHA. And have a look, go for it. It was a great experience for me. I was student director for 2 years, and that was great.
Hi, this is Emma Malik from CPHA. I'll just jump in at this point since I can respond to that question about the nominations for our board of directors positions. So we launch the call for nominations in May, and then the call closes in September, and then there are elections that open in October, and that close in November, and announcements are made in December, and the position would start in the following January of 2018. So definitely stay tuned for details on that. But students can run for a regular director position as well. So we do reserve one position specifically for students, that being the student director. However, if there are any vacancies on the board of directors, a student is eligible to run for those as well. So I know there are a few other questions regarding CVs and resumes, for example, but I'd like us to move on to Haytham Qosa's presentation, and we'll have more time for questions following that. So Haytham,
Hi.
over.
Hi, can you hear me? Hello? Emma, can you hear me? Okay, thank you very much. Hello, everyone, and welcome to this webinar. Today, I will go with you through a journey in the humanitarian and relief job opportunities. My name is Haytham Qosa. I'm a health recovery manager at the Global Health Unit in International Department at Canadian Red Cross. Okay. Emma, I cannot switch the slides.
Okay, I'm happy to advance the slides for you.
Okay, thank you. Thank you. Okay, just to give you a hint about the movement in general, the International Red Cross and Red Crescent movement. It's a global humanitarian network of more than 80 million people that helps those facing disasters and conflict. Actually, it consists of three main bodies: the International Committee of Red Cross, ICRC, and the International Federation of Red Cross and Red Crescent Societies, IFRC, and 190 national Red Cross and Red Crescent societies in different countries around the world. The whole three bodies form what we call the Red Cross Red Crescent movement. The main work of these societies and the movement is to help people during disaster and the crisis. Next, please. Our vision and mission, can you see here, is saving lives, alleviating suffering, and protecting, maintaining human dignity for vulnerable population that experience sudden emergencies, disasters, or crises. And also we help during development phases, after the crisis, and in recovery. In fact, you can see this sentence literally the same wording by different humanitarian organizations internationally and locally. It's a main mandate for all of those who working in humanitarian and relief operations to target and address these objectives. Next, please. Depending on main fundamental principles. These the 7 fundamental principles we consider during our work is humanity, impartiality, neutrality, independence, voluntary service, unity, and universality. In any work we do, either through national societies, through federation, through ICRC, in different countries, in different contexts, we make sure to keep our fundamental principles secured and applied in all situations. Next, please. By talking about numbers and types of natural disasters, this figure from the New England Journal of Medicine, it's obvious that we have increasing numbers since 1950 up to 2012. We see that there's a dramatic increase in number of natural disasters, and here we just include the natural disasters. We are not talking about the conflict and the crisis in different countries. We just here you can see number and types of different natural disasters and the estimated economic damage. You can see like we reach for 13 years for more than $350 billion of damage, economic damage. Also, you can see that there's increasing numbers of different types of natural disasters, either geophysical or climate related or a crisis also. So according to this increasing and dramatic increase in numbers of crises, there's consequently increase in humanitarian and relief operations around the world. This conducted by different national and international organizations, including Red Cross movement and mainly UN agencies as well. This increase in number of operations during emergencies, during recovery and development increase more people in the field, more people to manage and operate these operations, more people from different kinds of backgrounds to help during these operations. And this number actually, as I said, it's only related to the natural disasters. There's another figures about the conflicts and the crisis in different countries and in situations in the fragile settings in some of developing countries. Next, please, Emma. This figure is about the global cluster leads. It's from the UN agencies. It's mainly UN agencies who coordinate and lead the operations during emergency response. This I just showing this because it's similar to other international and national organizations around the world. Maybe some organizations are focusing and addressing one issue of these elements, but in general, the whole issues we address during emergency response and recovery operations. It's health, logistic, nutrition, protection, shelter, water and sanitation, camp coordination, early recovery, education, emergency telecommunication, and food security. Here, it's clear that UN agencies have a lead in each sector, and sometimes we coordinate with UN agencies in our operations. But for example, in the Red Cross movement, we have an emergency response unit in health, in camp, we have in water sanitation, and for shelter. We have different emergency units that help people during emergencies. This lead us to talk about, just to go back for the MPH students who's studying the social determinants of health. Here's exactly what we mean by social determinants of health. That health is not related, and public health is not related to the health and illness only. It's related to different factors that play a role in making people healthy and living in suitable conditions. It's related to the suitable water, protection, enough food and nutrition, and safe shelter. All these stuffs we addressing during our response. This gives us an idea about how many and how diversity of backgrounds and professionals we need during operations. Let's say for health, we're talking about doctors, nurses, pharmacists, logisticians. We need those profiles in the health, in response to health. In nutrition, we need nutrition specialists. Also, we need some doctors, pediatricians in this sector. In logistics, we're looking for pharmacists who can manage medical logistics, and also different profiles from economics and accountants. In protections, we need lawyers, we need legal people with some legal background to help in protections and detentions. In some countries, we follow up the prisoners in prisons. We need some people to help us in this sector. In shelters, we're looking for some people with the engineering background, with environmental engineer, with civil engineer to help us building and set up a quick shelters and camp and build the camps. In water and sanitations, we're looking for some water engineer, or looking some environmental engineer to help in these operations. In camp coordination, we need some people who can manage a crowd of people and manage a huge number of people inside camps. In educations, we need teachers. In communications, we need IT guys. Different profiles and set of skills we needed during this response. This is the beautiful issue in working in this field, that it's not related only to the public health, but public health degree is a critical and very, very, very crucial element in your CV if you applying to these positions. If you're coming from any background, engineering, accounting, psychosocial support, social worker, any kind of background, if you have a public health degree, that would be a great asset, and you have a great chance to be part of these operations. Next, please, Emma. Why and why not you may consider work in relief jobs and humanitarian field? Actually, the job for me with meaning that aligns with your values. If you believe in humanity and helping people and voluntary work, it's the target. You can find it there. Opportunities to make a difference. You will have an opportunity to help people who's suffering after disasters or crisis. The community of motivated co-workers, the people who's joining this work from different kind of profiles and countries, you will enjoy working with those kind of people. They are very dedicated, passionate about their work. You will love working with them, and we work actually in very supportive environment. See the world and experience different cultures. During our work, actually, we traveling a lot around the world to different countries, meeting different people and experience different cultures. It's something beautiful. It's we can say it's added value to your experience and human life and personal life. Why not? It's actually a workload during emergency operations and during relief effort, especially at the early stages of the work. It's heavy workload. It's really heavy. Other issue is about traveling and living conditions. As I said, we traveling a lot and we living in sometimes during in camps in it's tough conditions. Let's say it's not an easy and sometimes. And it's sometimes you can find it a stressful job because you dealing with people in crisis, people with many calamities and problems, and sometimes you find this stressful for yourself to see those all suffering around you and your help is very minimum to certain number of people. You feel it's really stressful. Next, please, Emma. At the end, I don't want to bombard your head with many links and websites to go through and look for these opportunities of job and different trainings and organizations. I just want you to consider this website. It's reliefweb.international. In the next slide, you will see just a print screen from the first. Thanks, Emma. You can see here all details about the ongoing operations around the world. You can see up here, you can see the updates and countries by countries. You can search by operations by countries and this type of disasters. Also topics, if you're looking for something health related to shelters, related to the water, whatever. And by organizations, you will see here a list of the whole organizations involved in the humanitarian work around the world. Also, you will see the list of jobs available by these organizations listed here. It's up to date. And finally, you can see a list of trainings related to the work. Some of these trainings are online and others are on site. You can look through these trainings and select whatever suitable for you. By looking through this website, I think you will build a great idea and a full understanding for the situations and opportunities around the world, and you can decide about your future career. Thank you very much, and any questions, I will be ready to go. I see there's some questions here. I'll start reading. So we have Dr. Qosa. Okay. So we have Dr. Qosa International Medical. Okay, for the questions from Serge Kapoor, yes, I have the same situation. I'm a IMG and I have the license, Canadian license, but actually it's in certain cases it's not enough to work in the field. With your public degree, yes, you can consider they can consider you in the Canadian Red Cross according to your background either because you are a doctor. I'm not sure if you are if you have specialized in certain in certain specialty, but you have to apply through the website for the Canadian Red Cross and see if there's any opening post now and apply to certain post. Otherwise, you can. There's now we are in the process of considering this option, but it's not out yet. It's an idea, and we discovering it about considering the international medical profiles, doctors and nurses in our roster for international operations.
Thank you for your presentation, Haytham. That was great. There's another question we have here from Brenda. She has a master's in science and environmental health and is interested in working in the humanitarian and relief field. But she's been having trouble finding work in this area. So any advice that you may have?
Yeah, just to give you a hint about how to get in this field. We have two let's say two main tracks to get in this field. To go through national societies first, the national like Canadian Red Cross here in Canada or any other national societies around the world, is to start by doing some volunteer job in your branch office, because in here the Canadian Red Cross has offices in all cities around the country. You will find Ottawa office and Toronto office and everybody in everywhere there's an office. You can volunteer doing some work as in volunteer basis there. By this way, they will know you. You will introduce yourself. It's like any other job, you know. They should know you before they know your skills, your profile, and will recommend you to the next if there's some openings, if there's anything opening in international operations, because we have two different departments here, to be clear, in Canadian Red Cross. We have international department who's working outside Canada. There's only one office here in Ottawa, based on Ottawa, and there's domestic department. Domestic department who's working inside Canada and dealing with the crisis and disasters inside Canada only, like what happened in Alberta recently, the fires. It's operated and managed by domestic department. Domestic department has offices in all cities across Canada, and the main entrance to go to the international operations, it's either through the domestic offices as a volunteer or doing some practicum. There was a session about doing practicum in these organizations. Yes, we accept practicum students from the MPH who can apply to do some practicum work with us in summer or in any time for 2-3 months. During this, we recognize you and know more about your work, and you can apply for a practicum in different departments. It's either in the global health unit or in shelter and WhatsApp, like what's match your profile. And this is the other path
Great, thanks.
you can follow to get in.
Is a master's degree sufficient in terms of the level of education required? This was a follow-up question from Nicole. Or do you need a professional degree, such as an MD or degree in engineering?
I think in certain cases, and if there's a desperate need for MPH, MPH is enough to consider a managerial positions, because during MPH study we have some leadership and health management background, and I think this in certain cases should be enough to manage these situations. To be honest with you, jobs outside Canada and international and in international operations in different countries, especially those countries in crisis and after disasters, is enormous, is huge, and a need is huge, either through the movement, Red Cross, or through UN agencies or others like Save Children, Doctors Without Borders, MSF, and many others, Oxfam, many other organizations. It's huge, but it's, as I said, it's a difficult context and tough conditions. If you can accept this at least as the beginning, you go there for 6 months up to 1 year, then this will open a door for you to get in better positions and in better countries. And so you can start with this in managing certain small projects and operations in certain difficult situations and countries. Based on this experience,
Okay,
this
thanks.
will open
And the
a new
following
doors
question,
for
perhaps
you,
both
for sure.
Annie and Haytham would like to answer. Sarah is asking for other examples of organizations outside the health sector where you might consider looking for jobs. So I don't know, Annie, do you want to, do you have any ideas to start out? And then Haytham can add on.
Well, there are definitely a lot of options. It really depends on what you're interested in. So, and what kind of options are available in your community. If you're interested in policy or different kinds of research, I would recommend checking out your local government or even the federal government if you're willing to relocate, or if you're in Ottawa or Toronto. These are honestly excellent places, and there's always room to move around once you're inside the federal government, and you'll be doing things that are related to public health. I also recommend checking out what non-governmental organizations are available in your community. For mine happened to be a homelessness advocacy organization and shelter, but there's also other kinds of work that's being done with the social determinants of health, with other public health adjacent kind of advocacy groups or service providers that you may be able to look into. So that would be my advice. I mean, really, the sky's the limit. If you happen to be in Quebec and Montreal, there's all sorts of pharmaceutical companies that are here, and they're always looking for researchers and policy people. So just keep an eye out, and lots of different kinds of sectors. Yeah, that's.
Thanks, Annie. Haytham, do you have any specific examples that you'd like to add?
Actually, I don't have a specific example to add, but um, it depends on your original degree. It's not only the MPH you have. It depends on the background you have. It directs you to the area to apply for. As we say, if you're coming from medical background and having MPH, it directs you to the medical institutions and medical field. If you're coming from the, let's say, epidemiological statisticians and mathematical background and having MPH, it directs you to the epidemiology, to the database management, research-based options. If you're coming from a legal background, it directs you to the help in protections, building policies, and it depends on your background first. It's not the MPH by itself. And in addition to your intention and what do you want to do. Because for myself, just to give you example for myself, before I enter the MPH, I'm a doctor in the profession, but before I enter the MPH program and I study my MPH degree, I was thinking and targeting to work with the Red Cross. This is why I took this degree, and at end of this degree, I was keen to take my practicum in Red Cross Society, so I ended up there.
Super,
working
thank
there.
you. Those are great
So you have to plan
additional
this
tips,
well based on your
Haytham.
background.
And certainly I can add just to a few comments that we've been hearing. Volunteering really is a great way to start out, to make yourself known to the organization and to continue to build your network. In terms of meeting the criteria that are posted on a job posting and then applying, no one meets every single criteria. Do not let that dissuade you from sending in an application. Part of the job application is really leaning in and putting yourself forward as a very strong candidate, highlighting how you do meet as many criteria as possible, but and also demonstrating how you're a quick learner and can learn on the job. So that's really what you just want to get yourself through the door by having a great resume and cover letter, and then when you have your interview, you'll be able to elaborate on your skills. And just again, we've been hearing a lot about networking and mentorship. CPHA, we are developing a mentorship program that we hope to launch early this year for our members, where we'll be matching up student members and early career members with more experienced members of CPHA. So that's something to stay tuned for. We do have in our series, the webinar in March is on the topic of networking and mentorship. So we have a bit of time left here. We can take, I think a few people are interested in being in touch with you, Haytham. So if you are open to being in touch with people, then perhaps you could type your email address in the chat box. And I think, okay, oh, yes. Sorry, great. Didn't see that. Okay, excellent. Okay, so I'm just going to go back and see where we left off in terms of the questions. So Lisa is asking for advice from moving from the private to the public sector. So she's worked in drug clinical research, but she does have an MSc and MPH and wants to move to a public health or a related career. So do either of you have experience working in the private sector and making the move from private?
I do not. But I do know some people who have made that switch, and if you want to get in touch with me, I can try and get you in touch with them to discuss that a little bit more.
Neither me.
Okay, thanks. So sorry, Lisa, we can't provide more of a response now, but we can follow up, like Annie mentioned. And you can also follow up with me, and I'd be happy to provide additional responses for you. So Rakesh is wondering whether you faced any political issues when trying to enter the field, and any recommendations, I guess, for overcoming those. I don't know, Haytham, if you'd like to address that first.
Yes.
So the question, no problem. The question is coming from Rakesh, and he's wondering if you faced any political issues
talk about
when you tried to enter the field.
Point, Emma. I just replied to him. I said no, there was no political issues in once because I have my Canadian passport. It doesn't. There's nobody looking for you where you are coming from. Once you are joining this kind of organizations and you have a passport that help you to travel around the world, nobody will ask, or you don't have any political issues. I just came last 2 weeks from Syria. I was inside Syria. I came from Palestine. I went to Nepal. In the last 2 months, I traveled to more than 7 countries. There's no political issues in this work at all. If in case there's some concerns about certain nationalities to be in such country, they will inform you in advance. Don't worry about this from now, because like I don't want to talk a lot about this, but there's some nationalities are
Great. Well, thank you
prohibited to
very
go in
much
certain
to our
countries,
presenters,
but if
Haytham and
all
Annie. That
organizations
was
know
a
about this, and
fantastic
they will inform you in
discussion
advance.
that you
Don't worry.
sparked with your respective presentations. And thanks to all of the participants. So I'm just going to wrap up with a few closing remarks. The next webinar in our series is happening on February the 2nd, same time and place. And Elaine Hishka will be presenting about her career in public health research in an academic setting. So any of you that are interested, registration is open now, and you can see the link posted now in the chat box. For those of you who may not know, the Canadian Public Health Association hosts an annual conference. Our next one is happening this June in Halifax. And there are a number of events and activities that are organized for students. It's a fantastic networking opportunity. And if you submitted an abstract, then you have the opportunity to be considered for an award valued at $1,000. Registration for the conference will be opening in February, so don't miss your chance to participate. I just wanted to profile some of our recent work, and we're always looking for volunteers to be involved in our policy and advocacy work. We recently published a position statement on early childhood education and care. We're involved in advocating for a public health approach to the legalization and regulation of cannabis. We're also working in the environment field to phase out coal-fired power plants in Canada. And we're also doing quite a bit of work around the opioid crisis. So some of the key contacts are listed here. I know that someone had requested to be put in touch with the current student director, Mansi. Her email address is listed there, as well as my own, and our executive director, Ian Culbert. So please do stay in touch. So thanks, everyone. You'll now be directed to a brief survey. So thank you for taking the time to send us your feedback. And thank you all for participating today. Have a wonderful day.